To Earth Mind Up. My name is Oluwatoyin Ibrahim. Today, we'll be telling you about the differences between paracetamol and ibuprofen. Here are the differences between paracetamol and ibuprofen. What are the drug classes of paracetamol? Paracetamol belongs to the analgesic and antipyretic, while ibuprofen also does the same thing as paracetamol as analgesic and antipyretic. But the only difference is anti-inflammatory. That means ibuprofen can what? Can reduce inflammation in our body. And what about fever and pain? Paracetamol also reduces fever and pain, while ibuprofen also reduces fever and pain. But inflammation, paracetamol does not reduce inflammation. It has weak inflammatory action, while ibuprofen reduces inflammation. That means it has strong inflammation action. Now let's come back to mechanism of action. How does paracetamol work in our body? Paracetamol work mainly on our brain. That means paracetamol work through our central nervous system. That means it work mainly on our brain. That is why the side effects are not much compared to ibuprofen. While ibuprofen, which is NSAID, is work mainly on our brain and also a site of injury, which is prostaglandin in our body. And what about the stomach irritation? Paracetamol is have low irritation to our body. While ibuprofen is moderate to high, because ibuprofen, you know that it's NSAID, which can what it can bring out what it can make stomach irritation in our body. That is why most of the time they usually prescribe ibuprofen with proton pump inhibitor like omeprazole, rabeprazole, because NSAID drugs they always cause stomach irritation. That is why omeprazole and esomeprazole and rabeprazole they are prescribed with NSAID drug like ibuprofen because of the irritation. What about the ulcer risk? Paracetamol is very rare to cause ulcer, while ibuprofen it is possible, because we said that ibuprofen they are NSAID which can increase bleeding, and from there it can lead to what? It can lead to ulceration, which also leads to ulcer risk. What about kidney risk? Paracetamol also have is very low in what? Causing kidney risk. While ibuprofen is higher in causing what? In causing kidney risk. Why is it that? Because ibuprofen, the excretion of ibuprofen, it is mainly through what? Through kidney. Now imagine somebody that is having a kidney problem. There's no where the ibuprofen will be excreted. That is why a person that is having kidney malfunction will be what? There will be higher risk in what? In ibuprofen. And what about liver risk? There's high in overdose. Paracetamol causes what? Causes liver risk, because it's somebody that usually abuse, that is a chronic alcohol abuse. When it's about to what? Excrete paracetamol, the alcohol will what? Will interact with with the paracetamol, which can lead to liver toxicity, thereby causing hepatotoxicity. While in ibuprofen, it is rare, but it can also possible because it can interact with other drugs, which can lead to another problem, thereby leading to liver risk. What about heart risk? Does paracetamol cause heart risk? It is very low. While ibuprofen it increases with long term. According to the studies, scientists that have studied ibuprofen, they found out people that use ibuprofen for long term use can cause what? Higher risk, which can cause a lot of cardiovascular risk like thrombosis and stroke and many other cardiovascular risk. What about the pregnancy? Does paracetamol is it safe for pregnancy? Yes, paracetamol is safer for the pregnancy. Even it is the most recommended dose in the hospital. While in ibuprofen should be avoided in in third trimester, because it's somebody that is about closer to 9 months should avoid ibuprofen, because it can affect the unborn baby. And what about the best use for what are the paracetamol is it best that is best used for? Paracetamol is best used for fever and simple headache, while ibuprofen it is best used for swelling like inflammation in our body, arthritis, that means inflammation in the joint, and injury pain. And what are the maximum adult dose for paracetamol? The maximum dose of paracetamol according to the WHO is 3,000 to 4,000 milligram per day, while ibuprofen is 1,200 milligram per day. Remember, paracetamol is safe in our body, and also while ibuprofen is also safe in our body. But when it is used for long term use, it can cause what? It can cause liver problem or kidney diseases, kidney problem, and many other complications. Remember, if you are not unsure about the drug, ask your pharmacist or your doctors. Thank you.